Hi there, I'm Dr. Chung, your friendly proctologist, and I'm so glad that you're here. Thank you so much for contributing to this community. It's because of you that this channel has grown as much as it has, and I just thank you so much for allowing me to be your proctologist on the internet world space, right? I'm also available by video consultation. If you find it that you're wanting to get a second opinion from me, or you want to hear what my take is on your situation, just email me down below at yourfriendlyproctologist@gmail.com. Today's video, I want to talk to you about bleeding that just won't quit after your anal surgery. And it doesn't matter what kind you had, hemorrhoid, anal fistula, fissure, blah, blah, blah. What are the possible reasons for it? And then how would you possibly go about attacking it? That's what we're going to talk about today. Let's get to it. Reason number one for wounds bleeding after surgery is because it hasn't been enough time yet. Wounds need time to heal. And if you can understand that we need to keep pooping through our anus, it's like we're peeling the scab every single time. So when the cells and the wounds grow a new lining, well, it may get shedded off or even just rubbed off by having a poop. So you can understand how challenging it is for a wound to stick around and finally heal. Usually wounds heal in about 6 to 8 weeks after surgery. But what if they don't? What if they're taking longer? Well, maybe because the surgeon created a very extensive wound for your surgery. Maybe you had a very complicated issue and that's why it's taking too long. Or maybe it's because your body doesn't heal very fast. You know, there's some conditions like hypothyroidism, diabetes, where wound healing may be delayed, or immune deficiency syndrome, right? Or a medication. You can see that the list goes on and on for specific situations that may apply to you. So definitely keep track with your doctor or your surgeon so that you know when things should be healing, how things are progressing. Number two is because of anal spasm, okay? And when anal spasm is occurring, the anus is closing extremely tightly. Why is it being so tight? Because it is super scared, it is traumatized, it's got some PTSD. You just had a surgery and the anus is scared beyond its mind and it is freaking out. So yeah, it's not going to just stay wide open and relax, it's going to close up on you, which means that all the wounds are being rubbed up against each other, and when you have to poop, okay, it is rubbing against everything on the inside. So you can understand why wounds have trouble healing and you keep bleeding. So you can get anal fissures from that type of situation, and you can also get hemorrhoid flares from that. Number three reason for bleeding is your stool textures. Of course, people, this is very, very important. The texture, and you want the poop to be soft. Ideally, you want to be in the range from formed yet very smooth on the outside, like fresh paved concrete, all the way down to the looser end of soft, which is more like frozen yogurt consistency. Anywhere in that range, your anus is going to love you for it, and you won't have to have any more increase or long-term bleeding than you have to. Number four reason for bleeding is that you developed a chronic anal fissure where the surgeon has typically done some cutting or some type of work there in the past. And again, I want to blame the internal anal sphincter muscle. It's squeezing so hard that, you know, you've got this one little sliver of a wound. You'll look at it and actually it's gone from a wide wound where that was immediately after the surgery, and now it's healed and healed and healed, but now there's this one crack right down the middle, and ooh, these can be super duper painful. The pain from the fissure then feeds back into this mess because it keeps the spasm going. The anus has every reason now to adopt this new behavior and freak out and squeeze. The last reason is a situation where you've actually done all the healing from your anal surgery. Your surgeon looks at you, does an anoscope, and says, gosh, you know, sir, ma'am, your wounds have all healed. There is no cuts left. And you tell him that there's still blood in the toilet, or you see blood in the tissue paper. And this is where you've got to suspect that the bleeding may not be from the anus at all. It may be from somewhere else, like from your colon, your small intestine, your stomach, etc. And that's where more evaluation with testing would need to be done. For example, like a colonoscopy or an upper endoscopy through your mouth to look in your stomach would be the next step. So now that we've talked about the reasons, let's talk about ways to attack it and address it. The first thing is always to see your surgeon, because a physical examination, looking inside, looking for wounds that could be responsible for this, or hemorrhoids that are in flare, that is what we need to address. So one thing a surgeon may see when they inspect you is a wound that has improperly healed. There may be a situation where there is a wound left, like a fissure, or even a situation where the skin has healed, but the wound underneath has not. So you've got this pocket where there could be pus and blood contained in there. Again, this is something only your surgeon can really see in you. It's very difficult for you to find on your own. But you may see blood or you may see discharge continuing to be on your tissue paper. When you got that kind of situation, the doctor is usually going to suggest to fix the wound. They may be able to do something in the office setting right there in front of you, but they may need to take you back to surgery if the situation calls for it. So be aware, don't be surprised if the surgeon needs to have you asleep to fix the issue. For treating open wounds or fissures, you want to try diltiazem or nifedipine. Those are creams you can get from your doctor from a prescription and put on the outside of your bottom end 3 to 4 times a day. Another solution, of course, is to always keep your poop soft during this process so your wounds don't get roughed up unnecessarily. Don't have hard poops as much as you can. Don't have loose poops, and don't have comet poops. If you need to check out comets, I've got videos that says what is a comet poop, but in general it's a mixed texture with hard in the beginning and super soft and fast at the end. The anus hates all of it. Toileting habits can be very helpful to heal wounds because it makes the pooping less traumatic. So relaxation exercises when you're on the poop so that your pelvic floor can lower down, so that your anus muscles can open up. Those are the types of practices and techniques we want to bring in. Other thing is using a squatty potty, for example, or just stacking some magazines up on the ground. Put your feet on top of them. It raises your knees up so that you can take advantage of some angles so you can poop easier and not have to strain so hard. Pelvic floor physical therapy. This is a solution that I praise all the time, and I think it's the cure for anal spasm. This type of physical therapy is extremely important. They can do so much to relax your muscles and teach you the proper pooping techniques. But remember, find a therapist that's willing to get their finger inside your bottom end, because that therapy, if you don't have it, that therapist is not doing enough for you. So make sure you get into a good therapy program. Switch out therapists if you feel like you're not improving enough. And if all those things above don't work, sometimes using a Botox injection to help with your anal spasm or those wounds that just won't heal but are giving you some severe pain. Botox injection can be used to paralyze and make those muscles shut down and relax. That way you can get more blood flow to the wounds and then heal these things and therefore get bleeding to stop. The first and foremost, definitely part of the solution is make sure you're in good contact with your surgeon and make sure to see them often and let them know what issues you're having. In the end, if they can't find anything, they may need to take you to the operating room to at least examine you and take a look. But always, always, always don't ignore that. Make sure you get seen so that you can get your issue handled. If you've got any questions or comments, please put them down below. Again, I'm always available for video consultations. Just email me at yourfriendlyproctologist@gmail.com. Have a great holiday season, and I will continue to see you next month in December 2024. Here we come. Bye bye.